This is an important discussion and one that you probably would not have heard before. I'm doing some case reports and I'm dissecting what's going on in the pandemic. And I'm going to talk about this paper about a case of encephalitis. And as usual, my perspective is around COVID. If you find that disturbing, this is the wrong place because everything that I do is going to be dissecting the mechanisms and likely presentations of this disease because it's still circulating. It just has changed form. This is why so many people are sick and nobody quite knows what's going on. So, what I'm doing is I'm applying my principle of understanding the details of the pathophysiology to try and make sense of what is going on. And what you will find is that people are just not thinking about COVID as a likely contributor to symptoms. I do it the opposite way around. As soon as nothing makes sense, I automatically think of COVID and start looking to see if someone had a prodrome. Now, this case, as I was looking at it, something blew up in my head, and I thought, oh my goodness, this is important. The implications of this case, I think you're going to hear about maybe 2, 3 years down the line, because I've just thought about it and I'm realizing that as I explore it, it makes perfect sense. So follow along if you want to understand this. So, this is a case of encephalitis. And once we say encephalitis, we mean inflammation of the brain itself. And in this case, it was early stage asymptomatic breast cancer. Now, you may be wondering, if it's breast cancer, why am I talking about COVID? Follow along and you'll understand a little bit more because you have to then read between the lines. Now, as they said, autoimmune encephalitis, autoimmune meaning that the immune system is targeting specific parts of the brain. And in this case, it is using specific autoantibodies to target a protein in the brain. And that protein is LG11 or LG11. And these autoantibodies disrupt it. And what this protein does is that it helps to get neurons to connect better. It's like a connector, and it helps neurons to work better. And so anything that disrupts it is going to damage the signal going from one neuron to the other. It is very highly concentrated in a certain part of the brain called the hippocampus, and this is where your memories are stored and managed. So you can expect that if this particular protein is affected, memory and thinking are likely to be involved. And this is where it gets very important. Now, when we talk about autoantibodies, in this case, and this is the important bit, in autoimmune encephalitis, LG11 or LG11, depending on which way you want to describe it, this is an IgG4 disease. Now, this is very important. And this is what just about 15 minutes ago, I thought, oh my goodness, this is critical. IgG4 is what we've been talking about in the pandemic, where technically the mRNA vaccines after the third dose for a significant proportion of people causes them to start producing IgG4 antibodies to the spike protein. People have told you it's no big deal. I think it's a big deal, and it's widely spread across the population. And what it means is that when people get infected, it may cause them to produce IgG4 as well. And that may be why many people have such subtle symptoms when it comes to COVID infections. They literally have almost no immune response. So let's go through this case here. Now, this LG1, in this case here, the normal clinical presentation includes cognitive impairment. That means your memories is and your thinking is impaired, rapidly progressive dementia, psychiatric disorders, sometimes seizures involving the face, focal seizures in the brain, with or without impaired awareness, and sometimes hyponatremia means low sodium. So this is typical of it, and it's treatable. This is an important point. And 2/3 of the people who are affected are male and usually older, 50 to 70 years old. And it's not normally associated with cancer, what we call paraneoplastic, meaning that the cancer, the neoplasm, is causing immune responses that affect distant organs. And in this case, it would be the brain. So it's unusual, which is why they made a case report, because they found cancer in this lady. And again, you may be thinking to yourself, well, if there's cancer here, why am I talking about COVID? Again, follow along. Let's look at the case presentation in detail. So here we have a previously healthy, asymptomatic white female, mid 40s. She came to the neurology department because of amnesia. She just wasn't remembering stuff, and going forward, anterograde amnesia. So now this is the important bit. She recounted testing positive for COVID-19 20 days before. So 20 days before she came to the emergency room, she was positive with mild respiratory symptoms, fatigue, and tiredness. This is the typical presentation we see with COVID. And this is why I'm saying is that it is so subtle these days. And my feeling is that part of the reason why it's so subtle is that people have IgG4. Now, you can imagine that they never mention vaccination status. I think you can probably almost assume. But in any case, usually they will say an unvaccinated female. So maybe we can assume that it was a vaccinated female, but that's an assumption. We don't know for certain. So after she tested positive, and this is the sequence, 1 week later, her fatigue increased. And so this is now another pattern. So her fatigue gets worse. Then she starts to have vivid and unfamiliar dreams and short-term memory loss. She's having panic attacks lasting 2 to 3 minutes, disoriented, crying, worsening anxiety. She can't sleep. And all of this was happening with a limited background of just asthma. She had an appendix taken out. She had polycystic ovaries, but that was about it. What clued them into cancer was that her mother had cancer in her 40s, and her maternal grandmother also had cancer in the 60s. You'll realize why this comes up and why it's relevant. So at this point, the only thing they have got in the history is that she had definite COVID. It's not a speculation. She had COVID. And so when they looked through all of the blood tests and so on, they didn't find too much. Her sodium levels were a little bit low, not too bad. They did an MRI scan of her brain, and it showed that a part of the brain, the hippocampus on the left-hand side, had some changes on the scan, which suggested something was going on, could explain the memory issues. They took a sample of fluid, cerebrospinal fluid. It was clear. The protein and glucose levels were normal. They checked all the things, and they found positive findings looking for these autoantibodies, LGI1 antibodies. So this is what clinched their focus. Now, what's interesting is that this is not a normal test. And so it suggests that, one, they had a lot of information, a lot of focus on looking for this, because if you hadn't tested for that, you'd still be guessing. And so this is an important piece of the puzzle. She also had an EEG. That's where they attach electrodes to the head and look for signals. And in her EEG, this is what it would look like. It was irregular, slow background rhythm, showed a focal seizure in the right temporal lobe. So it's all fitting with some kind of encephalitis. And remember, encephalitis is inflammation of the brain. So again, now we come to where did this cancer come from? Or where did that question come from? So, because they were doing ongoing investigations on her, they did a PET scan, positron emission tomography. And they did this, actually, a good question as to exactly why they did it. Maybe they thought it could have been paraneoplastic. So they were looking for cancer. And when they did it, they found that 2 weeks later, so this is probably as an outpatient, she had a lesion in her right breast. This was then biopsied and it was confirmed as infiltrative breast cancer. Okay. This is now the connection. So this is the reason they did the case report, because what they're thinking is that the cancer is causing paraneoplastic symptoms that cause the encephalitis. Now, remember what I told you, this autoimmune encephalitis is not typical in females, younger females. It's usually older males. Not that it can't happen, but it's not the standard presentation. And you have to remember as well that the breast cancer was an incidental finding. And it shows you that, interestingly, COVID is being treated as a nothing burger, if that makes any sense. So even when you know it's COVID, that COVID is present, it's still not actually relevant. Because when you look at a case in the discussion, to the best of our knowledge, this is the first well-documented case of anti-LGI1 limbic encephalitis associated with early breast stage cancer. So they have linked it to cancer. Now, as I said, I'm seeing patterns that are unbelievable in terms of unusual things going on. So I know COVID is causing unusual things. And what we have here is, let me repeat it, a generally fit and well female in her 40s gets a COVID infection. She's a bit tired, and then she finds, after about a week of minor respiratory symptoms, just going back to it, after a week of minor respiratory symptoms, her fatigue gets a bit worse. Then she starts having unfamiliar dreams. Then she has memory loss. And then she's having disorientation and crying, all within 3 weeks of a COVID infection. But the diagnosis is a paraneoplastic breast cancer encephalitis. That makes no sense to me. And they discuss this. They go back to it. They haven't completely excluded the possibility. So in their discussion, what they say here is, the truth is they recognize that anti-LGI1 autoimmune encephalitis is rarely associated with cancer. Okay? They acknowledge that. Then they point out an additional concern is that the patient had COVID a week before she noticed memory problems. There are several case reports of autoimmune encephalitis associated with COVID, including at least one possible post-infectious anti-LGI1 encephalitis complicating COVID. It has happened before. It may not be as exciting, but I'm telling you, this is a COVID-related diagnosis. It's just that nobody wants to talk about it. Nobody wants to think about it. Everybody wants to move on. I understand that. It doesn't mean that it's not going to do any problems. And here is the bit that I find is extremely important. By the way, this patient responded very well to steroids and immune suppression. She got better. I think she only had minor problems down the line. And so she did quite well with treatment. So it is very treatable, very responsive, these IgG4 related autoimmune encephalitis cases. But here is the important thing. A case report like this gives us an indication of the spectrum of disease. So she was a very significant presentation in a younger patient. But just imagine that she was 75 years old with a few comorbidities, got an infection, and then started having confusion, fatigue, and disorientation. Would there be any thought that this would be an IgG4 encephalitis related to COVID? I suspect not. And so this is where we have a really serious problem. Now, this is the final point, and I need you to grasp this. As I said, this is a spectrum. So the question you have to ask yourself is, if COVID is triggering elevated levels of IgG4 after infection in people who have been vaccine immune primed with mRNA vaccines, and these IgG4 antibodies block the LGI1 protein, but they don't block it completely. What people will then have is mild cognitive issues. If they're younger, they'll find they just can't think, they can't get their brain in order, they're just not able to process in the same way. If they're older, it will look as though they're having mild dementia. It's just progressive, and people will say, well, it's just because they're old and they're getting dementia. What you have to look for, in my view, in order to differentiate it, is one, you have to look for the fact that, one, did they have a COVID infection, or, because nobody's really testing for it, a recent viral presentation where somebody felt unwell, maybe minimal upper respiratory tract symptoms. They usually feel completely fatigued and washed out. And then a week and a half, 2 weeks later, they start to have changes with their cognition. This could be a COVID subacute, subclinical encephalitis. The implications of that are horrendous because COVID is circulating so avidly across the population. Because if we don't know this, we could potentially impact on it with just steroids. But steroids are not to be. But if you are talking about the difference in terms of the outcome, longer term outcome of somebody, it may be worth the risk. This is the beginning of what I think is going to be an area of research I'm going to continue to go down, because I know that this is relevant. If COVID is circulating, triggering IgG4 antibodies, impacting on the brain, causing cognitive symptoms, people don't know what's going on. They just can't think, they can't remember, they just don't feel well. That's the reality. That's what is likely to be coming in front of us. So again, as usual, I think it's important to appreciate the authors in the case. Here we have it, just as a final reminder. This is from Luxembourg and Belgium. It's Maria Uribe, Gilles Kutzem, Felipe Kersken. I don't know if I've pronounced it properly. And it was published last year in 2025. And so, yes, we appreciate these case reports because it allows us to look carefully at patterns and think about what may be going on. I'll continue to try and do this kind of work because I think it's important. And hopefully it will make sense to you, if not now, in a few years' time. Have a great evening.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.